Hi beautiful ones, and happy weekend. Welcome back to my channel. Today we're going to have two videos, so I'm doing the intro separately because I filmed a couple of days ago, and whilst I was editing yesterday I realized that it's coming up to be a 40-minute video, and I think nobody wants to sit and through that. So I'm going to split it in two, and one is going to be general information about endometriosis and a bit of my story. Then the second one is going to be and what I did and do to get better. So if you want to see the general information about endometriosis one, then keep on watching. Before I start talking about my personal experience, I want to give you some general information about endometriosis for those of you who don't know what that is. So endometriosis basically is a condition where tissue similar to the lining in the womb starts to grow in other places, such as the ovaries, the fallopian tubes, basically the whole genital area. Some doctors believe that this is a type of autoimmune disease, but there's a very limited amount of doctors who believe that, because they actually don't know what causes this condition. And one of the doctors that I saw explained to me that it can be a condition that actually develops from birth or immediately after birth. So there's a lot of opinions out there because they actually don't know what causes the condition. The only thing they know is that it can affect women of any age, but most commonly is women within their 30s or 40s. Sorry. It's a long-term condition that can have a significant impact on the person's life, the person who has it, but there are treatments who can help. There are medicine who can help, because if you ask me, treatment is something that it can be cured. Endometriosis can be cured. It's just medicine that can help you have a bit of a normal life. The symptoms of endometriosis vary. Some women are barely affected, and others have noticeable symptoms. Well, this depends of how advanced the disease is. But the main symptoms of endometriosis are pain in your lower tummy and back, so pelvic pain, that usually gets worse during your period pain that stops you from doing your normal activities, pain during or after sex, pain when peeing or pooing during period, feeling sick, constipation, diarrhea, or blood in your pee during your period, and difficulty getting pregnant. You may also have very heavily periods. For some women who are very affected of this, from this disease, it can have a big impact on their life and may sometimes lead to feelings of depression. The way they diagnose endometriosis is basically most doctors can identify endometriosis based on the symptoms, but unfortunately the only way to actually have a 100% conclusive endometriosis diagnosis is if you have quite an invasive procedure that is called laparoscopy. Laparoscopy is basically when a surgeon passes a tiny tube through a small cut in your tummy, so they can see any patches of endometriosis tissue. This is the only way to be certain if you have endometriosis. The reason of that is because, as I said at the beginning, endometriosis is the endometrial layer, which is the one that women normally have anyways, that spreads across different organs of the genital. So that is like a norm, like how should I explain this? That is a tissue that is not visible to scans. So the only way you can actually see it is if they actually go with the little camera in your tummy, in your genital bits, and they actually see that the endometrial is spread across other areas except the lining of the uterus. Treatment of endometriosis. As I said, there's no cure for endometriosis, but there are treatments that can ease the symptoms. And that is mainly painkillers, such as ibuprofen, paracetamol. They can be also a hormone medicine. Sorry. They can be also hormone medicine and contraceptive. Another treatment is surgery to cut away the endometriosis tissue where it shouldn't be. And another one, it can be an operation or surgery to remove part of all or all of the organs affected by endometriosis, such as surgery to remove the wound, that is called hysterectomy. Said that. Well, now after this short overview is basically a lot of information that I got from the NHS site, so you can see it yourself. I'd like to tell you a bit about my experience with living with endometriosis. So for me, endometriosis manifests mainly into a great deal of pain when I get my period, pain when I'm ovulating, pain before my period. So basically kind of 3 weeks out of 4 of the month I'm in pain. But to start at the beginning, I can say that I always knew there was something wrong with me, if you will, from this point of view, because from the moment I got my first period, I got very bad pains, and I went back to the doctors in Romania where I was living at the time, and I always told them I get really bad pains. They did all the tests that, well, they did. And I was told that everything is alright with me and that I'm perfectly healthy. It's perfectly healthy to have babies, and that is normal to have pains when you get your period. Which is fine, I agree. It's normal to have pains when you get your period. It's not normal to not be able to get out of bed when you get your period because you are in really bad pains, and to scream in pain, and to take all the medicine for pain that you have in your house and then not to do anything because you're in very severe pain. That's not normal, but I was told that's normal. That was me most of the months when I was getting pain, when I was getting my period, sorry. I was having very, very bad pain in all my pelvic area, basically. My lower back was hurting really bad also. My mom, who's a chemist, she had to, most of the months, bless her, she had to inject me at the end with painkillers. That was the only thing that would release my pain after taking pain medications. And even when I was bigger, and after starting my sex life, and again after going to the doctors and telling them, look, I'm getting really bad pains, I'm getting really bad pains when I get my period, I'm getting really bad pains when I have sex, for crying out loud, they were saying that that's normal. They were giving me silly excuses why I have these pains, and they were saying that everything is normal with me, that all the tests are fine and everything is normal, and I should get the pains. So it was just something that I had to learn to live with, and it was just something that was part of me. I was the girl who accepted that is very normal for me every month, once or twice, 1 or 2 days a month, to have really, really bad pain and to not be able to do anything. That was just my life, and I accepted that because that was told to me. Anyways, in 2000, to go back to our story, in 2012, I married my beautiful husband, and after having a miscarriage at the time, we decided to actively try to get pregnant. We didn't plan to get pregnant. Somehow it happened. I miscarried, and that was an awful experience that I don't wish on anybody. And if you are a woman who miscarried, my soul goes to you, and I really feel for you. I really know what you're going through. It's a terrible experience. And after that, we've decided to actively start having a baby, although from any point of view, it wasn't the right time to do that in our life, because we was broke. We were living in Romania. We wanted to get out of there. We were broke. We didn't have great jobs, great careers. We were about to have our wedding, because we only had the civil ceremony in 2012. It was just not the right time. But when you go through that, you know that you can't not try and not actually want a baby when you know how it is to lose one. Anyways, after a year of trying and not getting pregnant, I went back to the doctors in Romania. Again, we were still in Romania, and again, after tests, they told me that everything is all right. I did my tests, Alex did his tests, everything is fine, you guys should get pregnant, no worries. In 2015, 2015 we came here, which is UK, and the recommendation of a co-worker at the time, and Chris, if you're watching this, thank you very much, because she was the one who, after a few months working with her, realized that I have this condition and told me to urgently go to the doctor and tell them what I'm going through. And I did. I went to my GP at the time, and of course the GP here recognized immediately after the symptoms and after the fact that it was 3 years that we were trying to get pregnant and not happening. Sorry, I thought I lost my mic there. Anyway, she recognized the symptoms. She recognized that it might be endometriosis, and she recommended me to a specialist. Long story short, because I've already been talking for a while, in 2016, after seeing the specialist and going to the reproductive clinic and all that malarkey, I had a surgery, and they went in to my tummy. I have a couple of holes in my tummy. I like to joke about it and say that my tummy is like, you know, Tom from Tom and Jerry cartoons when he gets shot and he drinks water, and it's like a waterfall, like a hose. That's my tummy. I have a lot of holes in it. Anyways, after the surgery, they actually diagnosed me with severe endometriosis because I had and like the endometrial tissue was spread across almost all my genital base, both of the ovaries, but especially the left one. It wasn't a pretty situation over there. They cleaned everything up, and they told me that hope that I might be able to get pregnant after that, and that the pain will stop, and that well, basically after the surgery I thought that my whole world would change and I'll be a new person. Boy, was I wrong. It didn't. I still had the pain, and I can say that for the few 3 months after the surgery it was worse than usual. I think because everything was still, because they cleaned a lot. When they cut off bits of you, they actually cut off a bit of normal tissue with that, so that leaves a scar that needs to heal, and the healing hurts. Like, even if you cut your finger, it really hurts until it heals. It's just not good, and the pain hasn't got any better. It was actually a bit worse. Didn't get pregnant because you can't really get pregnant when you're in really bad pain. And it basically wasn't a very, very good situation after the surgery. I kind of regret doing it. So if you have this condition, and if you're thinking of having the surgery to clean everything up, I'm not really sure if I would recommend it. It's your decision. You have to think of the plus and the minuses, and it doesn't necessarily say that because my experience was bad with the surgery, and after the surgery that yours will be the same, because each body is so different, and because they don't actually know why this condition is happening in the first place, then you can't really know why it's happening for me or why it's happening for you, because it might be different, totally different reasons. It might be the same one, but it might be totally different. We don't know. So I don't know. This is not a professional opinion. This is just my personal story that I want to share with you guys. So don't take anything as gospel. Anyways, going back to how I am now, present times, I can say with a hand on my heart that I am much better, pain-wise, physical, emotional-wise, and all that, and it's been a long journey. And part of this journey is actually me doing this video for you or with you guys and sharing my story, because it's part of me accepting myself for who I am and for what I am, and that's been a long journey for me. And I think most women who suffer with this condition, they've gone to this journey. That was all for this video. If you want to see what I do to get better and what I do to help with the pain, go and check out the next video. Thank you very much for watching this one. If you liked it, please don't forget to give it a thumbs up. Don't forget to subscribe to my channel, and love yourself, accept yourself, and love life with everything that it has to offer. Thank you. Bye.